Hi, my name is Dr. Adrian Wee. I'm a plastic and reconstructive surgeon, and today we'll be talking about eye bags and cheek lift. So a lot of patients come to me complaining of eye bags and very dark eye circles underneath the eyes. When I look at this area of the face, I need to look at the cheek and the lower eye bags in continuity as one unit. When I assess the eye bags, I look at the skin, the amount of skin laxity, the amount of support that the lower eyelid has, as well as the amount of fat that is behind the lower eyelid and surrounding the eyeball. I also then look at the ligament which goes from the bone to the skin, which forms the very obvious line that a lot of these patients have, and at the same time look at the nasolabial fold, which is this fold that becomes more obvious as we get older. So when we do lower eyelid and cheek surgery, what we do is to try to rejuvenate that part of the face by removing any excess skin, any excess fat, as well as lifting the cheek if needed. We can do this in various ways, and the most common way of addressing lower eye bags is through the Scarless Eyebag surgery route. It's called Scarless Eyebag surgery because there's no external skin incision. The incisions are kept very well hidden on the conjunctiva of the eye, which is the pink area of the eye here. We make a very small incision there, go down and find the excess fat, and then remove it to flatten the lower eye bags. So in a Scarless Eyebag removal, we are actually going via the conjunctival route, which is the conjunctival route, which is the pink area of the eye on the inside of the eyelashes. And as you can see from the diagram here, what we do is go through that conjunctiva, find the excess fat. If needed, cut away the ligament which is holding the skin down and forming the very obvious line that we have in the tear trough as well as the cheek area, and then using any of the removed fat to replace it at the cheek to give some volume as well, because as people get older, there's loss of cheek volume. So patients who complain of dark eye circles can benefit from Scarless Eyebag surgery. This is because the excess fat that is in the eye bags pushes against the skin, causing a very obvious shadow which contributes to the dark eye circles. At the same time, the excess fat pushing against the skin can cause semi-permanent discoloration of the skin, and once it's removed, it will improve. Lower eye bags can be due to various causes. Some individuals are unfortunately born with it, while many others actually develop it over time as part of the aging process. In aging, the skin, the ligaments, as well as the fat of the lower eyelid all gets loose, which causes the fat to protrude out and form the lower eye bag. So a lot of patients come to me because they appear tired, they look old beyond their years, and in spite of adequate sleep, they still have very obvious eye bags as well as sad-looking cheeks. Some of my patients present with other features of aging and droopiness of the cheek, including a very obvious nasolabial fold, or the laugh line that we have right here. Through the eye bag removal approach, we can actually volumize the cheek and also lift up the nasolabial fold in what is called a cheek lift. What this does is it helps to lift the entire midface, which is from the lower eye bags all the way to the corner of the mouth, and it gives a very fresh and youthful appearance in the cheek.